Hello and welcome back. In our last Indirasead Anatomy video, we dove deep into the appendix, exploring its anatomy and how it can become inflamed. Today, we are taking the next step on Indirasead surgery to explore what happens when that inflammation requires an operation. We're talking all about appendectomy, the surgical removal of the appendix. Appendectomy is one of the most common emergency surgeries performed around the world. The primary reason for it is acute appendicitis, where the inflamed appendix becomes a serious health risk. Once the inflammation starts, medication alone often isn't enough because of the very real danger of the appendix bursting. If that happens, the infection can spread throughout the entire abdomen, a condition known as peritonitis. That's why surgery is so crucial. So, what happens before the operation? First, there's a preoperative evaluation. This involves a physical exam, blood tests to check for signs of infection, and imaging like an ultrasound or a CT scan to get a clear look at the appendix. An anesthesiologist will also assess the patient to ensure they're ready for surgery. Most appendectomies are done under general anesthesia, so the patient is completely asleep and pain-free throughout the entire procedure. These days, the go-to method for removing the appendix is laparoscopic surgery. It's a minimally invasive technique. The surgeon makes 3 small incisions in the abdomen. A tiny camera goes in through one, giving the surgical team a magnified view on a screen. Special surgical tools are then inserted through the other incisions. The surgeon carefully locates the appendix, seals off its blood supply, and then detaches it. The appendix is placed into a small sterile bag and removed from the body through one of the incisions. This method is preferred because it's so precise and gentle on the body. The benefits of laparoscopic surgery are significant. Patients generally have less pain after the operation, a much lower risk of wound infections, and they can go home sooner. For straightforward cases, a hospital stay might only be a day or 2. Recovery is faster, and the scars are tiny. However, sometimes a traditional open surgery is necessary. This might be the case if the appendix has already ruptured or if the infection has spread widely. In an open appendectomy, the surgeon makes a larger incision in the lower right side of the abdomen. This gives them direct access to the area, allowing for better control of the infection and a thorough cleaning of the abdominal cavity. While the recovery from open surgery is a bit longer, it's the safest option in these more complicated situations. Like any surgery, an appendectomy does have some risks, but they are generally low, especially when the surgery is done promptly. Potential complications can include wound infections, bleeding, or in rare cases, the formation of an abscess inside the abdomen. Your surgical team takes every precaution to minimize these risks. Fortunately, serious complications are uncommon. What does recovery look like? It really depends on how severe the appendicitis was and which surgical method was used. After a laparoscopic procedure, most people are back to light daily activities within a few days. It is important to avoid heavy lifting and strenuous exercise for a few weeks to allow your body to heal properly. You'll gradually reintroduce a normal diet, and your body will quickly adapt to life without an appendix. In fact, there are no long-term negative effects from not having one. Appendectomy is a perfect example of how a timely surgical procedure can be truly life-saving. Even though the appendix is a small organ, when it gets inflamed, it demands quick and decisive action. Understanding its anatomy, which we covered in our previous video, makes it clear why removing it is often the safest and most effective solution. If you missed our deep dive into the appendix itself, be sure to check out our video on Indirasead Anatomy. And if you enjoy clear, easy-to-understand explanations of medical procedures, you're in the right place. Thanks for watching, and don't forget to subscribe to Indirasead Surgery for more.